I'm Dr. Randy Pilgrim, your Enterprise Chief Medical Officer. I want to share some thoughts with you today about some things that have worked for me, some things that I've watched work for some other people. And I just want to share a couple of tips and tricks, and hopefully if these in particular don't help you, they will spark some ideas about what you can do. And I'm going to challenge all of us, including myself, to make this a real good study so that we can get better at this. Not only will we do better in the COVID crisis, we'll do better professionally, and we will feel better about it. So a couple things. Just to anchor us, burnout is the gradual progression from feelings of involvement and engagement, and if not even excitement about what we went into the profession to do in the first place, and gradual transition to exhaustion and cynicism and disconnection and a feeling of this just isn't what I thought it was anymore, and even anger and bitterness and frustration begin to creep in. And it starts affecting not only how I'm doing personally, but how I'm doing with the teams. So that progression is largely a result of the inability over time to balance the professional stresses and the challenges that we have with personal renewal that is sufficient for the task and the stresses that we have. So the skills and the interventions that are helpful, I'm actually going to share things that are, and I like to think in three buckets. What can I do right now? What can I do this week? And what can I do long term? So let me share a couple thoughts. And hopefully, as I say, in this very short little vignette, it'll spark some ideas and even commitments for you. So what can I do right now? It's amazing. As we go through a stressful day, through a stressful night, through a stressful period of time, little moments of disconnecting from what you're doing and from the intensity and connecting with myself and with my body. As well as just my thoughts and my overall emotions are really important. So as corny as some of these sound, and I admit they sound kind of corny, they really actually do work. Three that I found very helpful is number one, take 5 deep breaths. The first one doesn't mean anything. It just gets you started. The second one is you feel your lungs and your abdomen starts to say, oh, I'm doing the deep breath thing again. I remember that now. I've been practicing that. And by the fourth and fifth one, you start actually disconnecting and thinking, all right, I've reset. A little tiny reset is all you're looking for. 5 deep breaths. You can do that now. Secondly, get up and move. Even if you're moving around the emergency department and moving a lot, you're moving that way. So sometimes getting up and moving and changing your strength, your posture and the angle of your spine and things like that, just moving and moving differently than you are, gives you that little personal break. That's important. The third one, and this actually came to me, I still remember this. Somebody did this to me. One of the first things that happens when I'm stressed is I don't smile anymore. And a friend said, hey, Randy, smile. I dare you. And at first I was mad at him, and I certainly wasn't going to smile, but then I had to sit back, I had to disconnect from what I was doing, and then try to like fake it for a little bit. It turns out that actually if you can smile, it gives your body the sense that actually something's okay here and I can connect back with myself. Try it yourself one time. When you know you're not smiling or don't feel like you want to, just try to do it. Even if you fake it, it really actually makes a difference. So you can tell those 3 little things, those breaths, move, and smile, are just little tiny ways of reconnecting with yourself, which is a preventative measure for burnout. What can I do this week? I've got 3 things there. Again, maybe this will trigger some thoughts for you. Number one, plan your rest and then execute your plan. Particularly because of the shift work that we do and the circadian rhythm disruption, the planfulness around rest and then the executing the plan is really huge. In my case, I know that I have to try to disconnect about an hour and a half before I'm actually going to go to sleep. So I have to plan for that hour and a half. Otherwise, I back it up another hour and a half. Next thing I know, I've only slept 5 hours and I need more than that. So plan your sleep, execute the plan this week. Second, pick at least one relationship that you want to connect with, which brings you outside of yourself. Relationships are key in burnout rather than the isolation. So which relationship is that for you? Your spouse, significant other, a good friend, a parent? But pick one and at least make a phone call, if not a visit. And the third thing for this week, I love this one. I didn't make it up. Make a list of 10 things you're thankful for before you rest or go to sleep. that you've planned and now executed. There's always 10 things in a day you can be thankful for. And if I take the time to write them down, the gratitude is incredibly important and has been well shown, well storied, to be a balancer of your stress together with the refreshment that you need physically, mentally, emotionally. And finally, what can I do this year, long term? Over time, you really do need a plan to say, how's it really going for me? How am I doing? And I would recommend, and have done this myself also, not only do I need to have a view of how I'm doing, but ask people who know me well, how do you think I'm doing? What are you noticing? And one of the best things I've ever had happen to me is when people say, you know what, you seem to be doing better. And immediately I'm thinking, how bad was I? Better than what? But that kind of feedback where people can see that the balance is happening for me is very helpful, and that is an antidote to professional burnout as well. So that self-assessment is helpful in the long term. That's my long-term suggestion. So now, breathe, move, and smile this week. Plan your sleep and execute on it. Key on a relationship and write down 10 things you're thankful for each day. And then long term, how are you doing? The more that you live in concert with your values, the more that you live in concert with what you know to be important, and the more that you adjust when you become out of balance, which is a constant task, the more you will be immune to professional burnout. Hope those things were helpful for you. They have been for me over time. My very best to you all, and thank you for the work that you do.